What inspired you to become a dentist?
I don't really think I chose on my own until the age of 24. I didn't really have direction in my life. A Polish chemist influenced me for about 6 or 7 months. The guy prayed for me, directed me towards becoming a doctor. I registered for school in Europe and became a dental surgeon.
Welcome back to another episode of my channel. So today we've got a special dentist who is based in Guangzhou, and he's going to tell us a story of how his journey as a dentist. So yeah, what's your name?
Victor.
Victor.
My name is Dr. Victor.
Dr. Victor.
Nice to meet you, Emmy.
Yeah. Where are you from?
So I'm raised in the United States in a city called Troy, Michigan.
What are some challenges that you face as a dentist here in China?
First would be the government, of course. Government regulations are very difficult in China, especially if you want to practice or any type of medical staff or medical personnel. That was probably one of my biggest hurdles, was getting my licensing here in China, transferring all my documents from Europe to China, and then also finding my Chinese partner, who also happens to be a Christian man. Second obstacle would probably be the language barrier. There's just such a big difference between the Western world and the Eastern world, and not only how they do things, but also in the mentality and the urgency of having to fix their teeth. They're not so keen on having cleanings on a regular basis or even on doing fillings when they're necessary. They wait until it hurts type of patients. And I think this is the biggest obstacle, is that trying to explain to them that you cannot wait until it hurts. It's better to prevent things until other than doing them when it starts to be painful. So those would be my biggest obstacles. Just again would be the transferring of documents, the government approving you, finding a good partner here. In Guangzhou, you can't work without a partner or without a clinic that's sponsoring you. So that was a little bit difficult to do, but by God's grace, it was possible. And then would be the culture difference, links. Now I do mainly treat foreigners, so it makes it a little bit easier. But even the foreigners that come, being that they come from all over the world, they don't really understand some of the things that need to be done, because every country does their things in their own way. In the United States, we are raised to have cleanings every 4 to 6 months and take care of fillings as soon as cavities come in their mouth. But other places in the world, they go maybe once a year. Even if they have to do fillings, they say, I can wait. And so these would be kind of the biggest obstacles that I face as a dentist here, an international dentist here in Guangzhou, China.
So how long have you been a dentist in China?
I've been a dentist for almost 5 years. During the COVID time was probably the most difficult period. We almost got shut down. It's just the revenue wasn't coming in. Doctors and employees needed to be paid, and my partner and I didn't have the resources to really make ends meet. But by God's grace, we made it through that period, and I can say that things are getting a lot better now.
Cool, nice.
Yeah.
So what are the most difficult procedure as a dentist?
So probably everybody needs a cleaning every 4 to 6 months, depending on the amount of plaque that they accumulate in that period of time. So if they have more plaque, or if they have more urgency to remove the plaque or calcified plaque, then it's very important for them to come and get that done on a regular basis. Now, when people don't take care of their fillings, then what happens is that the cavity will just keep digging down until they reach the nerve. And at that point, it starts to hurt, and root canal treatments are necessary. This is probably where things start to get complicated, because everybody's roots are different, everybody's nerves are different. And if you need a root canal treatment, it can be pretty extensive, a little bit pricey, just usually not necessary. If people would have just taken care of their cavities when they were small, or even when they were medium-sized, or even large-sized cavities, then it would have been fine. It wouldn't reach a root canal treatment. Now, after, let's say that the cavity has reached the root canal treatment wasn't successful, or too much of the tooth was decayed, then you have to remove the teeth. We remove that tooth, and then probably bone graft, if there's bone that supports the tooth, would be necessary. If there isn't bone, then we need to put bone, and then we also need to put implants. So this is also more an extensive side. Now, my personal training was on wisdom teeth removal, and wisdom teeth are the most difficult teeth to remove, especially if you have your wisdom tooth that is horizontal as opposed to vertical. Usually what happens is the wisdom tooth can grow in like this, and then it becomes very difficult to remove. And this is what I studied for a very long period of time. What I've specialized in is removal of wisdom teeth, different kinds of impacted teeth, And this is what this can be challenging if you haven't done it before, and it still can be challenging if you've done it before, because sometimes everybody's tooth is different, everybody's position of their tooth is different, and everybody's bone density is different. And this is what most people don't understand, is that maybe Emmy's teeth are easier to take out, or actually more difficult to take out because he's from Africa, right? But then if you have a woman from Africa, her teeth are a little bit easier to take out. But if you have somebody from a European country, their bones tend to be a little bit softer. So the men are not as difficult as an African man, and the women are not as difficult as African women. So I would probably compare it, the African women to the European man. To bone density. Well, not quite, but something around that. And that's where it can also become very difficult, is because the volume of people in Africa, or even like the northern people, are very large. They have very big teeth, very big wisdom teeth. And it's a little bit difficult to remove these type of teeth, especially as you get older. This is why I highly recommend that you remove your wisdom teeth when you're young. If you are in your 20s, then that is the optimal time to remove your wisdom teeth, just so in the future you don't have to deal with the pain, you don't have to deal with recovery, your immune system is much faster, you can recover much quicker. And yeah, it's the bone density is very important to me as a surgeon. If he has very dense bone and very hard bone, it sometimes can be very difficult to remove that wisdom tooth. So from the simplest to the hardest, probably I would go from cleanings to fillings, then root canal treatments, crowns, aesthetics, and then teeth removal, and then implants, bone additions, and then wisdom teeth removal. That pretty much covers anything to do with your teeth and the oral cavity.
So I believe there are a lot of people that will be interested in working as a doctor here in China, and I think he has the best answer for that. What can you give to those people that are interested in working as a doctor here in China?
So that's a very good question. And nobody really helped me with this. And it was just by God's grace that I was able to be here, and even 5 years later. So first, you would probably for sure need to have all of your documents translated and notarized in your country, super legalized by the Chinese embassy in your country. Second would be to get a Chinese clinic or a hospital to sponsor you. And they would have to hire you, make a contract with you. After they hire you and make a contract with you, they actually take responsibility for you and liability as well. And that's the biggest one. Most cities in China require you to do this. Then afterwards, after you have the contract, the clinic by themselves, either they take you with them to register you, or they do it on their own. Now, some of the bigger hospitals, they will do it on their own because they've done this before. Some of the smaller hospitals might be a little bit hesitant to do it, but it's not impossible. It is possible. You can ask them to just follow the guidelines that are on the Chinese website for registering as a medical doctor or whatever field that you're in. And usually they'll be able to find it and follow the steps. Every year, your license needs to get approved again. Yeah. So that would be the biggest thing that is necessary.
Anybody that has teeth issues, come and check out Dr. Victor. Actually, he's a great dentist. People love him so much because he knows how to speak to his customers and also take care of people's teeth. So just come down to Bayun.
Yep, we're in Bayun, Huambian, Line 2.
This place is a good place for...
We're not far from the subway station.
Yeah, and you treat mainly foreigners, right?
Doesn't matter. Foreigners, Chinese, we get quite a variety of people coming.
Okay, thank you very much for...
Thank you, Emmy. God bless you, man.
Yeah.
Keep your head straight, and thank you very much for this opportunity. God bless you guys. Keep following Emmy. Don't forget to like and subscribe. This guy's an awesome guy. He's studying here in China, giving you guys some valid information about what's happening here in China. You guys should come visit, pray on it, see what God tells you to do, and God bless you. Remember, God does have a perfect plan for your life. Take care, guys.
Take care. Peace.